It's been 7 years now since the Saskatchewan Party cut intercity transport in this province. 70 years of STC buses were suddenly off the road. The province said the bus service wasn't making money. Well, losing that public transit created what Dr. Jacob Alhassan calls a web of dispossession. It hit women, it hit Indigenous people, and it hit disabled people hard. Dr. Jacob Alhassan is our guest today on Researchers Under the Scope. Hi, I'm your host, Jen Cannell, and today is Wednesday. It's the 1st of May, and on this episode of Researchers Under the Scope, Dr. Jacob Alhassan draws a direct link between public transit and public health, and what happens when you break that link. Dr. Alhassan is an assistant professor of Community Health and Epidemiology, and he's the academic co-lead for the University of Saskatchewan's Certificate in Global Health, and he joins me now. Hello, and welcome to Researchers Under the Scope, Jacob.
Hi, Jen. Thanks for having me.
Where would you say your interest in community health, epidemiology, and then tying that to politics, where does that come from?
Yeah, so, I grew up in Ghana in a rural community where there were lots of health inequities, so poor health outcomes for poor people compared to wealthy people, many instances of women dying of childbirth. I didn't have electricity in my home growing up, like lots of poor roads, poor infrastructure. But yeah, I think, my initial impetus was to think about fixing the health system and that kind of thing. So working as maybe a health administrator and like
run the local hospital.
Yeah, and try to make it very efficient. That was kind of my first way of approaching this problem. And I think for me, that was kind of a big motivating factor to always move towards like a systems thinking kind of perspective. And over time, this kind of shifted quite a bit to me becoming very interested in more the political aspect of health and trying to understand how politics makes us sick.
I know you arrived at the U of S about 7 years ago in 2017, and the idea was you were going to do your PhD in community health and epidemiology. What was your original plan and maybe how it shifted a bit?
Absolutely, yeah. So I arrived to do work on migrant health. So typically when immigrants arrive in a new country, they're healthier than the local population. But over time, they lose this health advantage and their health actually dips below the local population's health. And so the interest at the time for me was to kind of look at, do we have that in Saskatchewan? What is the level of that in Saskatchewan? And what are the reasons why this happens? The very next day after I arrived, my supervisor, Dr. Hansen, invited me to come with her downtown, that there were some protests going on and that she thought I might be interested in the kinds of conversations that were going on. So I remember, bright-eyed, bushy-tailed, met her and her partner. We drove downtown. It would have been in a church, I think. And, people were pretty angry. There had been a series of budget cuts from about May of that year, and there had been quite a number of protests. People were organizing and trying to reject the austerity measure that the government had instituted, right? So the government had cut hearing aids, the government had cut public transportation, all kinds of things had been cut.
I remember that. There were a lot of people who were saying this is going to hurt people badly.
Precisely. And I think at the time, not knowing that much about Saskatchewan or Canada, and being someone who has always, believed that politics and health are very, very deeply connected, I said, well, I will join the struggles of the local people, wherever I find myself. And so I knew that one of the big ones was the transportation system, so the STC that had been shut down after 70 years of operation. I wanted to take my time to basically excavate the history of the organization. Where did it come from? Who was affected by the decision? And what did it mean for health outcomes? And then develop, I basically rewrote a whole proposal and changed the entire course of my doctoral work. And, 7 years later, we're sitting here talking about it this way now.
Well, and it's funny because a lot of people who may have arrived in the meantime or who don't know Saskatchewan well STC buses, they moved people between so many, dozens and dozens of small towns to the major centers and back. And they also moved packages for us and for a lot of businesses. And that service was around since just after the Second World War, I think is when we started it, right?
Yes, yes. It was established in 1946. And, at the time that it was established, it was seen as a very important mobility link. At the time they shut it down, it served 253 communities. So it was definitely a huge source of movement of people, of goods and services and all kinds of things. And the health system really depended on it quite a bit, right? So for moving vaccines, equipment, like all kinds of things that the health system needed. So if you're in a small town clinic and you want to access a vaccine, it could just be shipped to you.
Yeah, you'd know that the bus would be there twice a day. It'll come in on the morning shipment.
Precisely. So it was a very integral part of life in Saskatchewan, because something that exists for 70 years becomes, a very important part of the community that it exists in. And I think that was one of the things that I really ended up learning about the bus and what it meant to the people of the province. Yeah.
Yeah. I remember the silver buses. I'd ride them from time to time. I took my daughter on them before. And even from when I was a little kid to when I grew up, people started talking more about, oh, look, there's another STC bus going by with almost no one in it. And the tone really became, oh, well, these buses cost so much money. We can just drive our cars. We can just do it ourselves. When you decided to do this as your doctoral research, how did you go about getting the information you would need?
Yeah. Yeah, that's a very good question. And I think, that's how I felt at the time. How do I do justice to this issue? Because it's obviously very political and everybody has an opinion on it, but we want to get as close to the truth of people's experiences of this bus as much as possible. So my work is very much guided by this idea that politics can make us sick. And so I wanted to draw on data sources that would give me the politics on the closure of the STC. So for me, even though health researchers don't do this routinely, I said, I'm going to go and look through the Hansard. So I literally looked through 40 days of parliamentary debates connected to the closure, right? So just trying to understand, how did we arrive at this decision? What was the logic behind it? What evidence was presented to show that it deserves to be kept or it deserves to go? What was the debate?
What was the tone in there, like after reading through all these debates?
Yeah, well, I think that there was quite an anti-evidence attitude, frankly. There was, up to this point, there isn't any well-regarded evidence that was presented to show, any kind of rigorous analysis that, okay, if we save, at the time they were saying 85 million from not having the bus.
Is that per year or overall?
Over the 5-year period.
Okay.
Yeah, so they're saying over a 5-year period, we're going to save $85 million. But they didn't say anything about what we would lose. Like if people can't travel, what does that cost us? When I started interviewing people, they were throwing out thousands of dollars of medication because the private services were bringing these medications, and the weather, if it's too hot or if it's too cold, it's just not arriving on time the way the STC was. So that's one example of a very obvious cost. If a cancer patient is starting to feel extremely stressed out whilst they're trying to get treatment for cancer, I don't know what that is in dollars. If a person feels lonely and they're no longer genuinely a member of this society because they have been truly pushed to the periphery because they have maybe epilepsy and can never have a license or something like that. I don't know what
they can't just drive their own truck down to town.
I don't know what the financial value of that is, right? So even though the framing in the document was very much that we would save 85 million, which nobody quite knew where that 85 million amount came from. It was just kind of an amount that was kind of pushed around. And those arguing against the decision, because some people obviously were arguing against the decision. They were saying, we should keep this bus because it serves indigenous communities. It serves women, primarily those who benefit from the service. It's important for climate change. This is like a human rights issue. So there were people who were kind of coming at it from that perspective. But of course, at the end of the day, those who had the power to make the final decision were not those who held the human rights sort of perspective. It was those who were counting the cents and dollars and deciding that $85 million is what we should be saving rather than all the other things that we might be losing.
Yeah, it was really seen as this bus is a money loser, we cut it.
Yes.
Not as this bus loses money, but it's an essential public service.
Precisely. And that's
last I checked, police departments lose money and fire departments lose money. A lot of public services just cost us money.
Yeah, and it's generally accepted, right, that we would do that. And that's one of the things that I found fascinating. And most of what I did, most health researchers don't do, right? Going to the Hansard to look for evidence. I also even went to the archives, right, to read through the initial reports about STC, the news articles about STC in the 40s, and like what was the tone of publications around it at the time they created it. And one of the most fascinating things I learned was that in the very first year that it was created, it made a loss. It made a huge loss. And the premier and the minister of transport, they all said this is not a big deal for us because we believe that in a province like Saskatchewan, a service of this nature is necessary.
Because we were so rural and so spread out.
Precisely.
And
Precisely.
Today, more than half of us live in cities now.
Yeah.
But it's still fairly spread out.
Yeah, a very spread out province. And I think, being able to travel from one community to another is impossible if you don't have an intercity kind of transport system. And so I think that was their thinking. So it was very ironic, really, that in the very first year it lost money, and in 70 years later that would be used as an argument to get rid of it, right? So yeah, I went through the archives, went through the Hansards, and I also interviewed people. So I conducted interviews with 100 people who had used the bus service. I was driving from town to town with I didn't have a license, so one of my...
Oh, wait. So you couldn't drive through any of this either?
No. Yes, there was a lot of, ironies in this whole project. I had a very good friend, Alexei, who is from Russia and was doing his PhD here at the time. And he had a license. So he would drive me from one small town to another small town. And we would meet these people, right? Cancer patients, older people, people in wheelchairs. And we would conduct interviews. We must have been a very comical pair, showing up, in our accents and asking about this very Saskatchewan kind of topic. But it was a very interesting experience moving from town to town and corroborating what I think we would have expected with actual lived experiences of people, right? Getting people to tell us, okay, so not having this bus, what does it do to you? And I'm not joking. There's lots of people that I spoke to that I can still just picture them very, very directly. I remember a guy, older guy in his 70s. He was going for cancer treatment, and he was telling me, being diagnosed with cancer is not a small thing. It's a big thing to worry about. Now, instead of just worrying about that, now I have to also worry about how I'm going to get to the treatment, right? So it's just this extra stress. And he literally said, sometimes I wake up in the middle of the night and I'm thinking, how am I going to get to the hospital? In addition to the fact that I just got diagnosed with cancer, right? So it was kind of adding this human dimension to it. So, interviews with individuals where they would share such stories, and then also healthcare providers where they would share, okay, this is how the health system is affected by us not having the bus service. So that's where I learned about the fact that thousands of dollars of medication were being thrown out, and that the health system was actually suffering because we didn't have access to the STC anymore.
What else stood out to you about the answers people gave you in those personal interviews?
Yeah, so there were lots of interesting insights. I would say, like, when I would ask people a simple question like, what did the bus mean to you? I remember that when I asked that to a very young, able-bodied person, they would give me a very instrumental answer. The bus was basically like an instrument that they used to do a particular thing. So they would say, the bus meant I could go to hospital, or I could go to school, or I could go to this specific place to do this specific thing. When I would ask someone in a wheelchair, or when I would ask someone with epilepsy, or someone with a disability who had no other way of moving, I would say, what did the bus mean to you? And they would say, freedom, right? So they would mention these big metaphysical kind of ideas that I think certainly set them apart in terms of what the effects of the loss of transportation is on them compared to the rest of the population. So there are many people for whom it may be probably just an inconvenience, but there are other people for whom it's literally a radical reorganization of their lives. People have had to move from town to town. Some people's lives have been completely dramatically changed, and many people completely broke down and wept during these interviews because like their lives were truly changed by the loss of access to transportation. So there's definitely this instrumental versus, I guess, more metaphysical difference in how people perceive the impacts of the loss of the company on their lives.
But the loss of freedom is the same as the loss of autonomy and independence, me deciding where I get to go despite the fact I don't have a driver's license. Now I have to ask someone for a ride. I have to ask somebody to come in, bring me, and then they have to go back to whatever it was they were doing before.
Yeah.
So now I'm feeling like a burden.
Yeah, and that's how people felt. Yeah, it's a loss of freedom. It's a loss of dignity. It's a loss of autonomy. Nobody wants to keep asking other people to help them. I don't know anybody who really genuinely just hopes that their life will be centered around asking other people to help them. Most people ask for help when they have no other option, right? And in most cases, I was talking to older people, some of whom had lived their whole life, done everything for themselves, were now starting to lose mobility or lose the sense of autonomy, or someone with a disability who is like, I have gone to school, I have earned a degree, like I have done other things for myself, and wherever I can do it for myself, I try to do things for myself. And suddenly, they are no longer able to do these things for themselves that they could do, right? So if you had epilepsy, for example, and everything else was fine, you could still live a pretty normal life if you had access to transportation that way. But without that, you have to ask your family member, you have to ask your friend. And yeah, the first few times it's probably not a big deal, but over time, it changes the balance of your relationships and you just feel bad. And I think that was what I was really learning, was that people just ended up feeling like they were less than, like they couldn't genuinely participate in society as normal citizens anymore because they didn't have access to transportation.
That's that web of dispossession you write about, being pushed to the margins. Like you just don't count as much.
Yes, partly, yeah. So the idea of the web of dispossession is also kind of connected to this idea that when we think of the loss of the bus, we think it's just the former bus rider who is affected. But it's not just the former bus rider. It's a series of other people that we don't immediately think about. So for example, let's take an older woman. She's in her 80s. She needs to go to hospital. With the bus, she typically can go to hospital. Now, there's no bus, so she needs to go to hospital. She has a 40-year-old daughter who has kids and a life and other things going on, but she's not going to let her mom not go to hospital, so she's going to take time off work. So now, this 40-year-old woman, who none of us think of when we think of the bus, is really having a hard time in her life because the bus is gone. If she can't do it, some other member of the community has to do it. So there's this web where all kinds of people that you don't immediately think about when you think about the bus and losing the bus become affected by the loss of the company.
You're losing that time at work. You're losing, you can't get to that kid's activity. You're still trying to make up the time at work and you're still trying to get mom to appointment and back. Yeah, and it's funny how we don't mention all the sons who are coming to pick up their parents, do we?
Yeah, so that's the thing. That's one of the things that I noticed too, right, was that it's a very gendered issue where because women often are pushed to this caring role, it's not impossible that there would be some men that are also helping take care of their parents. But in most cases, I wasn't encountering that. It was often middle-aged women who were bearing the brunt of what we call time poverty, basically no longer having time at all in their life because now they have this extra. In Saskatchewan, we're talking probably a 4-hour drive for somebody to go and pick their mom, take them to a hospital, take them back. And so it was a very gendered thing where something like that doesn't affect everybody the same way, but ends up falling on women. Yeah.
After you published your work on this, who noticed? Did any politicians take note?
Yeah, to some degree, I would say so. Yeah, I remember being invited by some local politicians in Saskatchewan for some, conversations on working on improving transit access. Not much came of it, but also I think one of the bigger ones was that I got an email from a member of parliament to come and speak, basically as an expert witness at the House of Commons and share about how my research showed why we need public transport. So I had published a piece in The Conversation which was kind of focused on why Canada needs a national public transport kind of system. And so politicians did notice, and it has created or generated some level of conversation, and there have been discussions. I'm not sure what the future of that looks like, but that has definitely been one of the things that has come of it.
Some people will say, you know, in a place like Saskatchewan, well, there's Rider Express and there's other buses, but I remember Greyhound cut all its buses about within a year or two of this happening. And now it is way harder for me to get to places that are not major centers. What does that do to a province like Saskatchewan? Like, what would you say you're hoping comes of this?
Yeah, I think I'm hoping that we can rethink how we do transportation in the in the broader scheme of things, right? So, for example, more cars on the road means more accidents, right? This is a fact that buses are one of the safest modes of travel. There's the climate change dimension where if you have a bus, you have 50 people in the bus instead of 50 cars on the road, or if you're lucky, 25 cars because they're driving in pairs, right? So there's definitely this shift in perspective that I hope comes of research. I think this is a problem, and that people, because that's the thing, when something like this happens, we just forget like it's an issue. But all the people I spoke to in wheelchairs are still in wheelchairs. The Rider Express that you mentioned briefly, it took someone taking them to the Canadian Transport Association for them to even use wheelchair buses. So there were people in wheelchairs who couldn't even use those buses at all. So we need a public transport system that is extensive and that meets the needs of a province like our own, which is very sparsely distributed.
So we might have to accept that it's going to cost more money than the tickets bring in.
Honestly, we are going to have to rethink how people move around. So encourage people basically to use public transport, have some kind of incentive that will get more people to use public transportation because it is the better option. And yeah, if there's some slightly higher financial cost, it's still likely not as high as the cost of the things I was talking about. People are taking time off work, people are feeling stressed out, people are going to hospital much later with worse conditions because they didn't have a way of getting to the hospital in the first place.
And in terms of your own work and your own research, so many people don't want to be political. Why say, yeah, okay, it's fine to be political? Where did that come from for you?
You know, I had a professor, my master's supervisor the first time was called Ted Schrecker, and he once published a book titled How Politics Makes Us Sick. And I think this was a huge shift in my perspective. I had done political stuff before. I had always been an activist and worked with communities for all kinds of things, but I always kept the scholarship and the politics kind of separate. But after reading Ted's work and understanding more and more how everything is connected with politics, it became very clear to me that I wasn't going to improve anybody's health if I didn't connect it back to politics. Right? If a politician decides today that they should bring back the buses, it'll lead to the change I want to see. And that's not going to happen if I kind of sit in the ivory tower and kind of disconnect myself from the political aspect of this. So I strongly believe in that. I strongly believe that societies and the health outcomes of every society is a political thing and is deeply embedded in the local politics, the decisions that are made, who gets what.
Well, if I look at who benefits from a political decision, so who benefits from the example of cutting buses? Well, people who sell cars or who give rides, I suppose. Really, it was framed as such a, let's just cut the buses. This will save us money. Nobody rides a bus anyway. Anybody who's complaining about it, well, they would complain anyway. And it was very, very easy to write off a lot of those concerns, I think, for a lot of people. What does that say about our politics?
Good question. And, and I might even flip the question and ask, how many people in wheelchairs were making the decision to shut down the bus, right? How many people with epilepsy who can never own a driver's license were part of those making the decision? How many older women who have had cancer and have no way of going to the hospital were part of it? So I think...
And Indigenous people?
Indigenous people, this is the whole point, right? So I think that it talks about, to my mind, what I will call a sort of politics of expendability. Like some people, some groups of people have essentially been constructed as expendable, right? They're not really necessary in the minds of some of these politicians. And I think that's a very problematic way of thinking about it, because we have a political system that is not necessarily arranged for the well-being of average people. Rather, it's literally a might is right sort of thing, where the most powerful people make decisions that deeply impact the lives of people who don't really have the voice to raise their concerns or to be heard enough, for us to understand that a decision to cut something like a bus company could radically change some people's lives and shorten it and make it less done, and that says a lot actually about the political systems that we have constructed in societies like this one.
So looking also at the global side of what you do and at the future, where do you go from now?
Yeah. I've been doing some work right now actually on free transportation. So there's a friendship center in La Ronge where they had buses, and in the COVID context, they got some funding and they were able to start a free bus service between La Ronge and Prince Albert. And so I've been doing data collection with those people and like trying to figure out what is the impact of this free transport. And, just a few weeks ago, I was at a conference in Washington and I met a few people, and there's a lot of interest in free transportation. And even in places like the US, there are literally places like cities where they have instituted free transportation schemes. And so I think that there's lots of opportunities for us to think about how do we measure the impacts of these kinds of interventions, and how do we show if in the long run it's the better option. Now, I know when people hear about free transport, they're like, no, this sounds dramatically ridiculous and too radical.
You should have to pay something, otherwise they won't value it.
But I have two questions for people who are thinking this way. The first is, why don't you pay to drive on the road? And the second is, why don't you pay to use an elevator? Right? These are all things that we could have decided that people should pay to use, but we don't, right? So there are things like that in our society that we already use for free, quote unquote. But it just means that we have all agreed that they are so vital, so important that they should be completely free at the point of use. But we as a society will fund it because we know that people are using the bus to go to work, that people are using the bus to go to hospital, and that if people will use it in this manner, that they should use it for free.
Jacob, thank you so much for telling us about it. Good luck. I'm looking forward to seeing what free transportation might look like in the future, and why not imagine it, right?
Yeah, absolutely. Yeah, and we should not struggle from a poverty of imagination. We should imagine big and see where we land.
Dr. Jacob Alhassan is originally from Ghana. He's an assistant professor of community health and epidemiology here at the College of Medicine at the University of Saskatchewan. He's also the academic co-lead for the U of S Certificate in Global Health. To see more of his work, go to medicine.usask.ca. Researchers Under the Scope is a presentation of the Office of the Vice Dean of Research at the U of S College of Medicine. We record and produce this podcast on Treaty 6 territory, and we pay our respect to the First Nations and the Métis ancestors of this place. We reaffirm our relationship with one another. And this is the part where we say thank you for tuning in. I'm Jen Cannell, your host, and you can find those dots up in the corner, hit follow show. Even better, go ahead and tell a friend about this episode. We are so grateful to you for spreading the word about Researchers Under the Scope.